I'm Brandon Staglin, and this is One Mind Brainwaves. Now, more than 4 million people have died from COVID throughout the world. There's new daily records being set for new coronavirus cases in many parts of the world. What we once thought might be over is becoming to be clear that it is possibly far from over. Depending on where you live, unequal vaccine rollouts and the fast-spreading variants of the virus and vaccine opposition are making this public health crisis apparently very far from over. Our topic today is the ongoing pandemic's impact on global mental health. Is this a parallel pandemic? Two experts are here to give us their perspectives. And later in the program, we'll check in with our team at One Mind Cyber Guide for their review of a mental health app called COVID Coach. But first, we're so glad to be welcoming back to the program a true friend of the program, a talented singer-songwriter, and a true citizen of the world. Hailing from the land down under with stints in Asia and California, she's toured extensively internationally and currently resides in Nashville, Tennessee. Welcoming back to Brainwaves, we have Anne McCue. Thank you so much for being with us today.
Thank you. It's great to be back.
Great to see you again. Wow, it's been a while.
I know.
Yeah, we last saw you at the beginning of all this horrible nonsense that's happening in the April of 2020, and we've been through a lot since then as a community, as a society. What have you been up to?
Well, not a lot as far as being a musician goes, in the sense that I have played 2 gigs in a year and a half, and they were very recently, the last couple of weeks. 2 live gigs. I've done some online shows once a month or so, and but I've been recording my album since we got the new president. My creativity has re-emerged, and I'm back on track at making a new album and also writing some fiction too. So
wow, you're a real Renaissance woman. That's amazing. Good for you to stay active and creative. You know, music has been a balm in so many ways. And you referenced something like this a moment ago, but do you find that challenging times stifle your artistry, or do you feel periods of struggle provide a source of creative inspiration?
Well, I think it depends what the times of trouble are, and when it was like it was for the last 4 years, where it's this sort of verging on fascism, you're worried every day about the future of America, that type of trouble stifles my creativity. I can't function when that's going on, and you have to focus too much on politics and, you know, the state of the country. There's definitely a superficial element that rose to the top, I made up a saying, the shallow rises to the top, and the shallow rose way to the top, and, you know, was just in our faces all the time, and I found it very difficult to be creative and write songs and record albums and stuff. Luckily, I was able to produce some other artists in that time, and so it wasn't all for naught, but I found that just in the last 6 months I've been writing songs, I've been recording my album, I've been writing fiction, and I've just felt this tension and dark cloud lift, and so that's been really exciting.
That's great. All that bottled up creativity is finally released and is coming out to create great new things for people to enjoy. Yeah,
hopefully they'll enjoy. In fact, I say to people, if you don't like my new album, don't tell me.
Okay. Yeah. Well, I look forward to hearing it. But you're going to perform a song for us today. Tell us, and it's called Desert in the Rain. Can you tell us a bit about this song? It's a vivid juxtaposition of 2 things that normally don't go together, but is also a transformation. Can you tell us a bit about Desert in the Rain?
Yeah, it's a song I wrote a long time ago, probably in 1995. I was going through quite a dark period. My mother had just passed away, and that was one of the darkest periods of my life, really. I think it is for a lot of people. It's very profound, and then also being a independent musician, you know, you're writing songs in kind of like a vacuum, and you don't know, you know, what's going to happen, how you're going to make a living, all this stuff. And a friend of mine sent me a card, and it put all this like sparkly stars in it, and I opened it up and it just all sort of exploded, and she just said how much she loved my music and keep writing, and I was one of her favorite artists, and I was like, oh my gosh, it was like getting an injection of enthusiasm, you know, and giving me a reason to continue. So I wrote the song. And, you know, it's about, I think people need to recognize what other people are going through and try and, you know, give them some positive energy every now and then.
That is so beautiful. Beautiful to think we need to be there for each other. And when that happens, it makes such a big difference.
I think it really does. I mean, this past year, people were very isolated. We were in lockdown here in Nashville for over a year, and it was a rare time when social media actually performed a worthwhile function where people could communicate even though they couldn't be in the same room. So
that's encouraging. Yeah. And this webcast will be distributed on social media, of course, and people will be able to hear your wonderful song Desert in the Rain. Let's use social media for something positive again. Will you please perform your song Desert in the Rain for us today?
Yeah, absolutely.
Talking, saying words I
Wow, and thank you for sharing that beautiful song. And I
Thank
love
you.
this the theme of it that we, if you're there for somebody, if you care about somebody and you let them know, you can change their life like a desert in the rain.
Yeah,
Yeah, what an
true.
amazing song. Thank you so much.
Thank you. Thanks for having me on the show again.
You are welcome. Hope to hope to have you on again when your new album is out, and if you'd like to come back.
Yes, I would.
All right. Well, I think you've maybe transformed some people's days today with your beautiful song "Desert in the Rain." So, thank you for being on Brainwaves, and have a wonderful rest of your day.
You too.
Thanks.
Bye.
Bye bye. Joining me now to discuss the state of global mental health are from Australia, Dr. Helen Herrman. She's professor of psychiatry at Orygen and also the University of Melbourne Center for Youth Mental Health. Dr. Herrman is a past president of the World Psychiatric Association from 2017 to 2020. And here in the US, Obi Felten. She's the founder and CEO of Flourish Labs, a mental health startup using cutting edge science and technology to foster better brain health. Helen and Obi, thank you so much and welcome to Brainwaves.
Thank you.
Thanks for having us. Great to be here.
Absolutely. Great to see you both. We'll start with you, Helen. Helen, we're talking about a persistent and ongoing threat to health, safety, and livelihoods. What does that do to people's mental health? What is the level of psychological distress out there throughout the world?
Yes, thank you, Brandon. And you've outlined the level of threat and uncertainty that people are facing. And certainly this moment in our shared history has brought great fear and uncertainty to many people. And that's been recognized at community levels and government levels and international levels in a way that the field feels is a really important moment to take advantage of. So I think many of us are familiar with the story that there's a lot of fear and uncertainty that people who contract the infection, the COVID virus, can have direct effects on their brains and mental health. But perhaps more frequently, there's the concern about the effects of the consequences of the pandemic on people's mental health, on isolation, on loss of livelihood, on safety. Violence in homes is a tragic consequence for many members of our communities. So how do we consider this and assess it and use it as well? But in some ways, it's helpful to think of this like the consequences of other disasters and emergencies. And I know in the United States, you're experiencing something that we're very familiar with, unfortunately, in Australia, these terrible new wildfires, as well as floods on levels that haven't been seen previously. So that sense of how communities react to emergencies is quite often a sense of, for individuals as well as for whole communities, a sense of growing alarm, uncertainty, concern about anxiety and depression and its effect on communities, the worsening for people with other mental health problems, other health problems. But over time, that tends to recede, and we may be seeing some of that. But one of the major underlying consequences is the increase that the pandemic itself brings in the inequities in our communities worldwide. Those who are already at disadvantage, those who are refugees or displaced in various ways, those who are minorities, those who are economically disadvantaged, it's worse for them. And that also seems to be in some longitudinal studies that have been conducted already in a range of countries, including in Australia and the US, is showing that for some of the most disadvantaged groups in different ways, that there's a sustained negative effect on people's mental health, on their levels of depression, anxiety, or likelihood of developing such a condition. So that maybe 1 in 5 in our community is in that circumstance. And some of it is because of the cumulative nature of the disadvantages or the traumas that people who've been through the pandemic and then the wildfires and the scaffolding that's put in place to deal with one set of traumatic consequences is, or consequences of trauma, is then washed away by the next emergency that arises. So I think we have to look after those groups in particular.
Absolutely. And you mentioned the cumulative effect of these multiple crises, one after another, and they I assume they build on each other. You know, it's if people have no respite from stress and trauma, then the brain's systems move into overdrive. The sympathetic nervous system becomes always active, and people can't have any relaxation and any repair within their systems to come back to a better state of mental health. And so it seems like with all these things going on, there really is a crisis happening in people's mental health around the world.
And I think particularly for those who have already experienced mental ill health, those with certain long-standing conditions, they are in some ways among those vulnerable groups in this situation.
Yeah, that we experience these serious mental health conditions. Like me, for example, I experienced schizophrenia. We have these innate, we're already at a mental health challenge of having to manage our stress just from our biological makeup. And so these added stressors are, they compound the distress that we feel. Obi, may we turn to you?
Yeah.
Okay. Well, you grew up in Berlin. You studied at Oxford. Following years of success in the tech world all over the world, you've now founded Flourish Labs to try and tackle the problem of poor mental health, which is a global health crisis even before COVID. And you're starting with college students. What is the overall picture right now of young adult mental health? And how has the pandemic affected your mission?
Oh, great. Well, thanks for having me again on the podcast, Brandon. So I do have a psychology degree from Oxford, but my career has mostly been in tech. So I started in e-commerce in the 90s, and then I worked at Google, and then finally at X, which is this innovation lab at Alphabet. And my last project at X, after I worked on things like self-driving cars and internet from balloons and drone delivery and climate change projects, I started a project called Amber, which was using brain-based biomarkers, so using EEG to measure brainwaves and machine learning to better assess depression and anxiety. And like many clinical studies, ours was also paused by the pandemic last March. And so we actually, at the end of last year, decided to just give away all the technology. So we open sourced the EEG and we published our machine learning methods and so on. And so I just left X in June after wrapping up that project. And I started Flourish Labs. And our mission is flourishing minds for all. And we're starting with college students. So I've been interested in youth mental health for a long time, mostly through my board work with people like the Wellcome Trust who have a real interest in youth mental health. And also I'm on the board of a digital therapeutics startup that made a video game for young people to help them regulate their emotions called BFB Labs. And the reason I got so interested in youth mental health is because the numbers are really startling. Like the need is so high. So 75% of mental health problems appear before the age of 24. So high school and college is when they typically show up in someone's life for the first time. And even before the pandemic, 30 to 40% of young people were affected by mental health problems. So that's about double the adult population. And now it's closer to 50%. And suicide's been the second leading cause of death amongst that age group for a long, long time. And that's actually globally. So the problem is huge. But the opportunity, if we can help someone at that stage, is also huge. Because if you help someone in their early 20s, to figure out how to manage their mental health, it changes their life trajectory. And like you, I sort of have personal experience of this, and that when I was 29, my boyfriend was diagnosed with bipolar disorder. And we'd been together since Oxford, and he had his first episode of major depression when he was about 19, but he wasn't diagnosed then. So in those days, that was pretty typical, like 10 years from like onset to diagnosis. And so he'd been cycling through like mania and depressive episodes for almost 10 years before he got diagnosed. And we were together for most of that time. And we had no idea. When he was diagnosed, people were like, we said, what's bipolar? And he had a great outcome. He had a fantastic psychiatrist. He had a good therapist. He had a lot of peer support from friends and family and other groups. And I kind of called the company Flourish Labs in his honor, because he's, to me, an example like you that people can flourish with serious mental illness. So to me, it's like there's two different axes. There's like, are people diagnosed and are they flourishing? And they're two different parts of the square. And so I'm really interested in how can we get young people to flourish, whatever their mental health condition is.
That's fantastic. I love that approach. It's like focusing on the strengths of people, building on those, and helping them live the lives that they deserve to live and would like to live, with that quality, with that flourishing, that thriving that you have named your company after. And I think that living in a way that is healthy, it compounds on itself, right? If you are struggling with a mental health condition, but you're able to start kind of behaving in ways that are healthy and doing the things that you care about doing, then you're able to kind of let go of some of that. I've been able to let go of some of that patient mentality, which kind of held me back and caused more stress within me. I wonder if that's true for a lot of people, but I like your focus on flourishing.
Yeah. And I think in the pandemic, what's been so interesting, there was a great article by Adam Grant, where I think in the New York Times, and I think it was entitled like that meh feeling, that you've been experiencing during the pandemic. It's called languishing. So it's like the opposite of flourishing. So I think during the pandemic, many people sort of felt that feeling that is familiar to people with mental health problems, but wasn't familiar to everyone. And I think one thing the pandemic has done here is like with everyone experiencing some anxiety about, am I going to get sick? Are my loved ones going to get sick? And so on. That empathy for what it's like to have that experience, I think has gone up in a way that we've never seen before.
Yeah, that's encouraging to see for sure. We'll talk a little bit more about that later. So Helen, with this new wave of infection sweeping the globe, a certain COVID fatigue, that languishing that Obi was talking about, must be setting in for the general population, and especially for frontline and medical workers. Mm-hmm. What is the toll on mental health providers at this point?
Yeah, well, thank you. And I also perhaps begin by thinking about that question of flourishing and the question of recognition, whether it's among frontline health workers or the general population and policymakers, that the state of mental health has many factors contributing to it. Mm-hmm. So, as you mentioned, our brains and bodies, our general health, but also the circumstances that we're living in and the whole age groups, preceding life history. So many factors, like all states of health. And it's not just all or none. So I think that the consequence is that we need to get the messaging right. What do we mean by mental health? Mental health is something to be valued, and flourishing is valued. As I think it's great too that Obi is talking about that, and that we need to think of the ways that we know are effective to prevent and treat mental ill health. And that's, you mentioned the mental health providers. That's a pretty broad term if we think of the health pyramid that's familiar to many in health circles, at least, and perhaps in social circles, where we have people's own self-help is the foundation of any health pyramid. Then we move to a slightly narrower group of of community health providers, whether they be community workers of various types or primary care physicians or workers, and then moving to the more specialist providers who are usually very thin on the ground, even in wealthy countries, except perhaps in New York City and Melbourne and San Francisco, where you don't have that many psychiatrists per 10,000 population or psychologists. So how do we mobilize our mental health workforce, and how do we save them or how do we rescue them, if you like, from their sense of languishing, from their sense of burnout is another frame that people have used. Particularly in my period as president of the World Psychiatric Association in the first year of this pandemic, interacting with our colleagues in, whether it was in Italy and other parts of Europe, whether it was in New York City or other parts of the US, or latterly in India and now in Indonesia and in all parts of the world, and losing colleagues, losing people who have died. This is a frightening situation for people on the front line, whether they're specialist mental health providers, whether they're community workers who are being supported and trained by the specialists in the ideal. And I think it's a bit like the cycle of emergency described before, that we've been through the worst in many places, though it's still happening just north of my country here in Indonesia, the fourth largest country in the world. They have infection out of control in Jakarta and other parts of the country. So I think we think of all sorts of ways, ranging from making sure they have protective equipment, which is not a given at all in many places, but also using the ways that all the ways that we might use in other segments of the population to avoid and ameliorate languishing and burnout. So mutual support and information, advice, and making sure that people recognize their efforts.
Yeah.
Can I jump in there?
Please.
Last year, I worked on a pro bono project called Heroes Health, which Brandon, you're familiar with as well, right? Which was the idea was started by Sam McLean, who's a trauma researcher and an ER physician at the University of North Carolina. And Sam saw this in March. He was standing in the ER and he said, like, my colleagues are really suffering. Like, this is like something we've never seen before. People are dying in front of our eyes. And he realized that this was going to be really, really tough. So he called me and he said, well, I need a tech partner. I want to build an app that helps healthcare workers track their own mental health and then connects them with resources at their local hospital. Because the other thing we, of course, know about healthcare workers is they are so focused on helping other people that they're often not helping themselves, right? And so we built this app in just under 3 months, and it launched last July. And it's kind of weird looking back now, because we thought we might be too late. We thought, oh, if it takes us 3 months, like maybe we'll miss the pandemic, right? And now, look at where we are now. So that's been used in 14 hospitals across the US for the past year. And what's been interesting about it is that allowing people to self-track and then having peers reach out to them was incredibly powerful. So in Jefferson Hospital, they implemented in the School of Nurses, and they trained nurses to help other nurses. So when the app flagged someone as high risk and that person gave us permission to reach out to them, like a nurse would reach out. And that kind of peer support of like someone who was in the same situation, who had the same lived experience, who understood what, shoes that person stood in, was really, really powerful. And the people sometimes didn't even realize themselves, like how close to rock bottom they were, how bad it was, because you just keep running, thinking about everyone else and not about yourself. So I think we haven't even seen the worst in that population, because it's only going to be once COVID is going to slow down, that's when the trauma will actually appear. We know that. We know that's how trauma works, right? Like people are able to suppress it for quite some time.
Yeah, I love what Sam and you and others have done with that app. And we at One Mind are very proud to have supported financially the fundraising to enable that app to spread to those 14 hospitals. I'm loved hearing the stories about how dozens of healthcare workers had been averted from awful outcomes, like they had suicidal ideation at those times. And what you're talking about when you say that these peers reach out to their peers, that may help the ones who are reaching out know for themselves that they might also be at risk, because they're helping peers in the same situation as them, so they can then prioritize their mental health a little more, I would hope, as well.
Yeah, that's right. That's right. And actually, when you look at the literature around peer support, it's not just the person who's being helped who benefits, who has better mental health outcomes, but it's the person who's helping as well. So Alcoholics Anonymous, for instance, sponsors Stay Sober for Longer. And that was exactly the same effect here. So that shift turned out to be the nurses' favorite shift, like when they were doing the mental health call center shift. I mean, maybe that tells us something about how awful the other shifts and their core job were at the time. Wow. But I think they just really enjoyed being able to give back to their community, and that helped their mental health in turn.
Definitely. Obi, many students of all ages will be returning to school soon and trying to make up for a year of lost development and still enveloped in a cloud of uncertainty. Do they stand a better chance of getting the mental health help that they need once they're back in school?
That's a really great question. So the honest truth is nobody quite knows what's happening in the fall. So I've spoken to lots of university administrators, to people who run counseling centers, and to students themselves. And they're all sort of bracing themselves for what happens when 2 classes come to campus for the first time, not just one, right? The reality is that demand for mental health support has outstripped the supply in college mental health for a long, long time. And part of the issue is that people think that the gold standard treatment is meeting for an hour a week with a therapist, a licensed therapist, right? That's sort of seen as the gold standard. And that's a model that hasn't really changed since Sigmund Freud invented it like 130 years ago, right? And so the students show up and they want therapy. And then when they're being offered alternatives like peer support or like group therapy or coaching, they sort of almost think that's like a lesser thing. So I think we need some sort of marketing campaign that changes that perception, like across the general population, not just the students, that one-to-one therapy is the thing. We need other methods that can scale better, because we're never going to be able to train enough therapists. So digital therapeutics is obviously one avenue. So online CBT can be highly effective, especially if it's mixed with face-to-face therapy. I definitely think peer support works really well in a student setting, because again, you have that lived experience. They don't really trust the adults anyway. And they trust their peers much more, because that's the transition they're going through, right? They're going from orientating around family and parents to orientating around peers. And the important thing about it, it also promotes human connection. And the students I've spoken to, they're really craving that real human connection. Like after sitting at home, doing Zoom lectures, which frankly is like, that's the worst part of the education, right? Like if you think back to your college experience, you don't remember sitting in a lecture theater, absorbing content. What you remember is all the other amazing things, like playing sports and doing theater and like meeting your best friends and meeting your future spouse and so on, right? So that is, I think, what they're looking for when they come back. But the wider point, I think, is that we need to get away from this one-size-fits-all model where everyone gets prescribed the same drugs or the same type of therapy, to more fluid models where we can change these modalities also over time as people move in and out of different mental health states. And what we need for that is better measurement, because we need to be able to answer the question of like who needs what help and when, because it changes over time. And we need to be able to answer that question both at an individual level as well as at the population level.
You are very advanced in this, and I can tell you have done a lot of research on and have a lot of experience in working with people who have these mental health challenges. Thank you for the wonderful work that you are doing with Flourish Labs and all the other projects you've worked on. We're talking today about the ongoing pandemic's impact on global mental health with Obi Felten, founder and CEO of Flourish Labs, and Dr. Helen Herrman, past president of the World Psychiatric Association. She's currently a professor of psychiatry at Orygen and the University of Melbourne's Center for Youth Mental Health in Australia. And viewers, don't forget, if you have any questions you'd like to ask our guest today or any comments you'd like to post in the comment section of this webcast, please feel free to do so. And if the information you're hearing today, if you feel it could benefit somebody that you know or care about, please share this webcast with them. Helen, back to you. Some studies have shown that the world's populations may be weathering the pandemic's psychological challenges actually better than expected. That the global psychological immune system may be stronger than we had once thought. Are there some good signs, in terms of resilience, or is it too early to tell? And do techniques like Obi has just been talked about, like peer support and coaching and so forth, could that help people's resilience more than we've been giving it credit for?
Yes, look, thanks, Brandon, and certainly the techniques and the possibilities that Obi is mentioning are adding many important possibilities to the population support that we haven't had in the past. But even from past experience and current understandings, there's a sense that populations do bounce back, as we've talked about, whether it's an earthquake or a flood, that populations go through stages of despair and apathy and infighting, but that successful communities will, as the phrase goes now, build back better. And that's the aspiration, whether we're seeking a green renewal, whether we're seeking some different resolution, even stronger than that we've had as communities. That could be the aspiration, but perhaps one of the strongest ones is greater equity in our community, greater income equity, equality, greater less discrimination on all sorts of grounds, greater safety for the majority. But as previously mentioned, particularly for communities that we can start to identify, there may not be such bouncing back, and they may need the sort of supports that Obi's been talking about, and that we can provide face-to-face through our health communities as well. And those are groups like, in many parts of the world, groups like the young people. Now, the older people have said, well, what was it like to live through the Second World War if you lived in London? Or what was it like to live in the United States? Again, there were opportunities often for women as workers, but there was fear, there was squalor, there was loss of opportunity educationally. People were removed from their families and contacts. And communities need to restore those things. And the young people will often take it. They've lost all the things that Obi's talking about. They've lost the capacity to get together, to meet their friends, to play sports, to be creative. And women have found themselves in living in close quarters with people they fear. People who've been through wildfires are now facing epidemics as well, or those who've been through the viral shut-ins are now finding themselves in physical danger from wildfires. How do you pick yourself up after multiple emergencies? And that is not, that's been shown time and again to be a compounding problem rather than easing the way. And I've come back to the group of people living with mental ill health, that people with long-standing mental ill health have particular need for supports, and also to make an opportunity to make the contributions, to make connections with each other, to gain support from families and communities, and make the contribution that they're able to make. I think for many people, it's being able to make that contribution, not being shut out of those possibilities.
Yeah, I can totally resonate with that. A great part of my own recovery from schizophrenia has been being involved in community activities. It gives me a sense of purpose, a sense of social responsibility, that I'm doing something worthwhile to help others and the world, and so that's really satisfying and keeps me on a more even keel and motivated.
Yeah, and I think for the underlying message for people, whether they're living with mental ill health or whether they've lost their homes and livelihoods, is to be given that chance to build on adversity and think of new ways of doing things, and to find that flourishing. And we know there is a story of that's somewhat disputed, but no doubt there's some truth in it, that there can be a growth after trauma, and there can at least be there can certainly be a communal redevelopment after trauma.
Yeah.
But it's important not to leave that inevitable group. There will inevitably be people that need additional support to join in that.
For sure, definitely. Some people have greater innate resilience than others, but I think it can be learned and can be it's kind of spread from person to person. I think that if people are around others who are resilient, it may give them the vicarious strength to continue and working for their own well-being. That's part of our I Am a Champion contest, which we're running right now, where people share their stories about what they've learned from their mental health challenges, and using that as a sign of the positive outcomes that can come from the adversity they've experienced.
Yeah. Could I just say too that I think people around the world have been really concerned about rising rates of suicide, and particularly among young people. Mm-hmm. And thankfully, that's not coming to pass, although there was concerns in some countries, in Japan at one point, and we need to keep monitoring this very closely. But rates are too high anyway. But is this an opportunity to use the sorts of things that Obi's talking about to really tackle these problems and use the prominence that mental health has gained in the public discourse?
Yeah, I think it is a great opportunity. Obi, you're working on the Healthy Brains Global Initiative, which touches on many of the topics we've talked about so far: youth mental health, inequities around the world in mental health care and outcomes. What kinds of resources will be needed to tackle brain health conditions now and into the future around the world through such initiatives as the Healthy Brains Global Initiative?
Yeah. So another great initiative started by the Staglin family. Your dad's been very involved in starting that for many years. So the goal of HGBI is to mobilize billions more dollars for brain health research. And that's to benefit people living with neurological disorders, but also mental health disorders more broadly. So to me, it's about brain health, but it's also about mind health. And the reality is that investment in brain and mental health science has been relatively small compared to, for instance, investment into cancer or other chronic diseases like diabetes. And much of that investment has been very biomedical, so on the neuroscience side of the house. And I'm a neuroscientist by training. I love neuroscience. But the truth is that our understanding of the underlying causes of these diseases has not really been progressed. So there's now a number of people in the mental health community, and including myself actually, who say maybe it doesn't really matter what is the underlying cause of it. We should understand better, like what works for whom and when, and how can we get some of these interventions and get more innovation around these interventions that make a real difference to people's lives. So I think we need a broader definition of mental health science and what it includes. So I'm particularly interested in the implementation side. Like, there's so much incredible science and innovation that's been happening in academic labs across the world. So how do we get that science out of the lab and into the real world? And one of the things I'm particularly proud of that we pushed as a board at HGBI is, how do we involve people with lived experience in the design of the research and in the design of the interventions. So we have a lived experience council now that has young people from around the world who are very vocal about what they want. And they don't want to just be a research subject. They don't want to just be a patient. They actually see themselves as playing a very active role, both in the research as well as in treatment. And I think that's a really important aspect that many other organizations working in this field have overlooked.
I'm so happy to hear the vibrancy of that lived experience council. I'm proud to have kind of suggested that as part of the HGBI early on in the formation of the organization, and really glad to see how far it's come. I think that's a huge boon to have that as part of the organization, as it should be for, I think, any mental health organization.
Yeah, it's astonishing to me how few people, also technologists, building mental health products, like, don't talk enough to the people that the products are for. I mean, I come from consumer technology, and if you don't take into account what the people want, like, your product is dead, right? And it's so easy to switch in consumer tech, where, like, you can just go to another product at the switch of a button. So I guess the world I come from, it's absolutely essential. But in the world of healthcare and health tech, it seems definitely underpowered.
Yes,
yeah,
I think it's coming into its own in youth mental health for sure.
Yeah, because they're so vocal about it, right? And it's a real generational shift between millennials and Gen Z, and that Gen Z has much less stigma. I mean, not all populations. So, Black young men, for instance, or Asian men, there's a lot more stigma still around mental health. But I would say in general, that population talks about mental health in a different way, demands mental health, right? Like, they're saying, like, why are you fixing my broken leg, but not my broken heart? And is just much more activist around it. And I think it fits with their general attitude that they want to make the world a better place. They want to contribute. They want to help each other. So that's why there's so much of that groundswell.
And their families as well. The families are fighting more and more to be part of the story.
Yeah, that's true.
Yeah,
that's true. Whereas in 50 years ago, the family would have buried anyone with a mental health issue.
Yeah, the greater public discourse around mental health is really great to see. And for example, we're seeing more open and frank conversations about mental health in so many different arenas, like the Olympic Games. There's greater awareness at the Olympic Games, with Olympic officials stressing support for athlete mental health as a priority, with high-profile athletes like Naomi Osaka and now Simone Biles being applauded for prioritizing their mental health above competition. Is this the silver lining to the pandemic, this greater awareness and acceptance of the need to help people with their mental health challenges?
Yeah, well, I think definitely the raising the profile of mental health and raising it in a certain way that's it's not them and us, that everybody has mental health and needs to value their mental health, to value their opportunity to flourish, as Obi would tell us. And that it's not one route to that happening, that people who've had past experiences that that compromise their mental health can be helped to manage those rather than bury them. And people, we can design our communities and consider the systems that we live in the midst of to make the conditions more conducive to mental healthy life, whether it be building in green spaces, building in opportunities for creativity and connection. So I think that those high-profile people you mention, the fact that they feel the way many other people are secretly feeling is extremely important.
Fantastic. What do you think, Obi?
Well, I think it's been super interesting watching that play out. And I mean, it's not all positive, right? They're still being vilified on social media just as much as they're being applauded, which is really sad to see. And I think what people forget is how young they are. Now they're 24, both Naomi and Simone. So these are young people who've been in an unbelievably pressure cooker environment for many, many years, have pretty much given up their youth in order to compete at that kind of level. And are put on a pedestal quite literally, right? And so for them to come out and talk about this in an open forum on a global stage must just be unbelievably difficult. And I hope that athletes to come thank them, just like there's LGBT athletes coming out in the NFL for the first time and so on. Like these they're really trailblazers for breaking down the stigma around this. And I think student athletes is one of the groups I'm really interested in. Also student veterans, because these are groups that are under sort of additional pressures, first generation students of color and so on, and athletes too, because even at college level, that pressure can be very high. I think what's interesting is that coaches, at least in the US, are starting to recognize that there's a linkage between physical performance and mental performance, right? Especially in tennis. A huge amount of performance in tennis is about keeping your calm, John McEnroe notwithstanding, who used to throw his racket and break it on the court. But it's about keeping that kind of mental focus. And so if you don't have that, then your performance is going to be impacted. So to me, it actually would be very natural to say athletes need to be supported in their mental health because it's going to make them better athletes. So it's a little bit like diversity and inclusion in business, right? People used to talk about it as a moral issue for years and nothing changed. And then it became a business issue because people suddenly understood that having a more diverse workforce actually is good for your business. And I feel like this might be a similar thing, right? Like that having better mental health will make you a better coworker, will make you a better athlete, will just enable you to perform. So maybe we need to rebrand the entire category, because when people say mental health, they actually don't mean mental health, they mean mental ill health often, right?
Yeah.
And maybe we should be talking about mental performance rather than mental health, because we could just reinvent a new term that wouldn't have the stigma attached to it.
That's brilliant.
That's the marketing person in me speaking.
Yeah. So people can ultimately flourish, and their performance can flourish as well. Thank you, both of you. And so finally, the lightning round. 5 questions, quick answers, one person at a time. We'll go with Helen first, and then circle around for Obi's answers. Are you ready, Helen?
Oh, do my best, yes.
Okay, here we go. What helps you cope when you're going through a tough time mentally?
I think my long-suffering husband, talking to him, talking to the family and good friends, and walking at a high pace.
Wonderful. What song or type of music do you turn to when you're feeling down?
Well, I go. It's hard to go past Wolfgang Mozart and J.S. Bach for particularly that joyful exuberance of Wolfgang Mozart.
Yeah, it's so inspiring. When I was really sick, I played Mozart to pull me back out of that disassociation. I love Mozart too. Mm-hmm. What hobby or activity helps you unwind and de-stress?
Well, I found during the pandemic that I've gone back to cooking and even shopping for cooking, going to the fresh food outlets, and we're fortunate to have those opportunities, but also playing some piano.
Love it. What is one thing you'd like to see change as a result of this crisis?
Well, I'd like to see us have a green revolution and introduce a universal basic income.
That would really make a big change. And finally, what gives you hope?
Well, the fact that humanity has been through a lot worse, or at least as bad. we're facing a huge emergency in terms of the climate emergency and loss of biodiversity. But if humanity can gather itself together, and that we have done this in the past.
Yeah, there are examples. Thank you, Helen. So Obi, are you ready?
Yes, I am. This is like a game show.
Yeah. Okay. Who wants to be a flourishing person? Okay. What helps you cope when you're going through a tough time mentally?
So I've been doing yoga since I was 17. So almost all of my life. So that's how I get my alone time, is doing yoga. And then on the flip side, connecting with my long-suffering husband and also with friends. So that's what I've missed the most, I think, is seeing groups of friends during the pandemic.
Yeah, we are social creatures. It heals us to be together.
I'm an extrovert, so I really suffer when I don't get that time.
Are you? I couldn't tell. Great talking with you. So what song or type of music do you turn to when you're feeling down?
Right. So this might sound cheesy, but my 8-year-old daughter and I love Imagine Dragons, and we turn it up really loud and we dance to it. And my favorite song at the moment is Whatever It Takes.
All right. All right. Inspiring. What hobby or activity, maybe yoga or something else, helps you unwind and de-stress?
So we spent a lot of time during the pandemic in Tahoe. We're really fortunate. It's a beautiful mountain landscape with a very large, gorgeous lake. And so I took up paddleboarding, and it's very therapeutic. You paddle out. It's both great physical exercise, like an all body workout, but it's also very rhythmic. So it has that sort of therapeutic quality for me of just like unwinding. Like I can't be unhappy on my paddleboard.
Love it. Sounds meditative. What is one thing you'd like to see change as a result of this crisis?
So around mental health specifically, I think it's more openness to innovation, like just the amount that was broken open in the last year, like teletherapy is such a good example, or telemedicine in general, right? We went from 5% of therapy sessions being online to 95%. And it's gone back a little bit, but I think it's going to be over 70% like forever, because people realize that it was just a better way of connecting than having to go to someone's office and sit outside an office door and so on. So that kind of general openness, because what happens when you have a kind of big change like this, like all the old arguments don't, like, oh, we can't do this, we've done it differently for 20 years, no longer cut quite the same way. So that's my hope, is that people will be more open.
Absolutely. And then, and what gives you hope to generate these innovations?
So I think technology is progressing, and it's not the answer for everything. It never is, right? Technology is only ever part of a solution. But the fact that we have these solutions at our disposal now, that we can scale things, for instance, through online platforms in a way that we were never able before, gives me a lot of hope, because ultimately that's a way that we can address that imbalance between supply and demand that has been dogging mental health for ages. But the thing that really gives me hope is actually what we talked about earlier, which is that this next generation is so activist, like whether it's around climate change, right? Like demos, not going to school to protest for climate change, or a 16-year-old taking it up with Donald Trump on Twitter, right, and winning, or mental health, right? The fact that they're so determined to improve their own mental health and help each other, that gives me a lot of hope.
Absolutely. We just recorded an episode, which you'll see soon, which had a young person, a student leader, incredibly inspiring young woman, articulate, passionate, great leader in mental health. Hope you'll watch that episode when it premieres as well. So thank you
Definitely.
both.
And I want to meet her.
Okay. Hopefully I'll introduce you. Thank you, Obi. Thank you, Helen. And thank you, viewers, as well. There's actually, speaking of technology and innovations and hope involved in that, there are thousands of mental health apps on the market. So how do you choose which one might be helpful for you? Here's our team at One Mind Cyber Guide to tell you about a mental health app called COVID Coach, along with the rating system they use to understand these mental health apps. Take it away, Cyber Guide team.
Hi, My name is Martha Neary, and I'm the project manager of One Mind Cyber Guide. At One Mind Cyber Guide, we provide advice and guidelines to people who are interested in using mental health apps. Mental health apps can be a great tool to add to your mental health toolkit. Research has shown that apps are especially helpful when used as an add-on to traditional treatment with a licensed provider. In one study, which looked at apps to help reduce depression and anxiety through skills-building exercises, participants saw benefits from using the app for just under 1.5 minutes each time. This suggests that even using an app for a couple of minutes each day might be helpful for you. Most good habits can take a little while to form. Building the use of an app into the daily routine that you already have may help you use it in a more sustained way. For example, maybe you brush your teeth and then use the app, or use it after dinner. Most apps also allow you to set notifications, which can be really helpful to remind you to use the app regularly.
COVID Coach was developed by the US Department of Veteran Affairs National Center for PTSD to help people manage the stress and challenges associated with the pandemic. There's a lot of content in this app, including relaxation exercises, guided meditations, journaling tools, and suggested activities to help you relax, stay inspired, and find meaning. You can favorite the tools you find most helpful so that you can easily return to them later. You can also track your mood, anxiety, and other symptoms and set goals to help you stay on track. The resources section has resources to help you stay well, stay safe, and stay healthy during the pandemic. In addition to crisis resources included in all apps developed by the VA, COVID Coach also includes resources addressing specific topics that have sadly seen an increase since the beginning of the pandemic, such as meeting basic needs like food and shelter, financial stress, and others. The app is completely free and available on both Android and iOS. We've reviewed COVID Coach at One Mind Cyber Guide, and it scores 2.67 out of 5 on our credibility scale. Reviews of the user experience and transparency of the privacy policy will be coming soon. You can learn more about COVID Coach on our app guide at cyber.guide/COVID Coach. You can also visit our blog where we have a Q&A with the lead developer of COVID Coach discussing how the app was created and how it might help.
We look forward to seeing you next week for another app review.
Thanks, Cyber Guide team. And thank you so much to Anne McCue, to Obi Felten, and to Helen Herrman for being with us today. And viewers, thank you so much for watching and participating. Don't forget, you can post questions and check out all of our past Brainwaves episodes at onemind.org/brainwaves. And there you can even sign up for our weekly newsletter to catch all the Brainwaves episodes as they come up into the future. Bye, everyone, and looking forward to seeing you next week. Thanks.
Mental health is stepping out of the shadows and into the spotlight.
I think I need help.
Can you talk?
Struggling.
I'm here.
Depressed. Can't sleep.
But we need the science and solutions to change lives. Now, more than ever, we are in this fight together. We are of one mind, accelerating brain health for all. Help us fund new treatments at onemind.org.